What happens during inhalation? And we could see from this question that all of the options are in regard to the diaphragm, and we need to determine the answer to two questions. So one question we need to know, is the diaphragm contracting or is it relaxing? So that's one question we need to know. And then we also need to answer another question. Is it moving upward or downward? So if we take a look at this diagram of the way the diaphragm is positioned here during respirations, we could see two things. So we know that when we allow air in, our lungs need to expand to make room for this air to come in because more air is entering the lungs, so we need to accommodate for that, as opposed to during exhalation, the air is leaving the lungs, so the rib cage can get smaller as the rib muscles relax to allow for this air to expel from the lungs. So if we're allowing for extra space in the lungs, then this diaphragm, which is positioned right below the lungs, to allow the lungs to get bigger, it would need to come down more to allow the lungs to expand, as opposed to when during exhalation, the diaphragm comes up and the lungs get smaller. So we know that the first part of this question should be that the diaphragm should move downward. So we know that it's moving downward and moving downward based on what we saw in that diagram. So because this says upward and upward on options B and D, we can eliminate option B and eliminate option D. So now we know that the diaphragm moves downward during inhalation. So is this diaphragm contracting or is it relaxing? So inhalation is an active process which involves energy, as opposed to exhalation, which would be a passive process and would not require any extra energy. So the passive position would be for the diaphragm to just relax and go back to its position. However, if we're expanding and expanding the lung larger and larger to allow for more air in, and the diaphragm needs to push down to allow for the lung to expand, that requires effort and that would require a contraction. The diaphragm is not in a relaxed state in that moment, but it can relax and go back to normal position during exhalation. So therefore, while the diaphragm is moving downward, it is also contracting. And therefore, option A would be the correct answer to what is occurring during inhalation.